So you have infertility. Let's see what your options are. We're going to discuss exactly what your options are. We aren't going to go deep into each detail of each one, but we can discuss what your options are. Let's get to it. So there's a couple options that you do have when you do have infertility. I'm going to go over a couple of them. I won't go into great detail about each, but there are a couple, the ones that are on option, they're on the table for us to carry out, I definitely will go over. So if you're finding that you still have questions on some of those, leave a comment below and we can definitely go back and see what some of those are. So the first couple are things like fertility drugs, surgery, of course there's IUI, which is right before IVF, and then there is ICSI, which is intracytoplasm sperm injection, which is a mouthful. And then there is GIFT, which is gamete intrafallopian transfer, ZIFT, which is zygote intrafallopian transfer. And then you can definitely do donor eggs and embryos. And then you can do surrogacy. So the two that we're gonna definitely talk about are the IUI and IVF, because usually at this point, if you're looking up infertility things and you already have gone through the infertility drugs to see if you can get pregnant. Now if you do want to learn about some of the infertility drugs that I'm taking, you can definitely check out the video above. I definitely go into the different types of medications. I also go into like how they're helping, and then you can check out a couple of my other videos because it does go into more detailed about the trigger shot and things like that. So for as far as IUI, it's intrauterine insemination. So pretty much what the IUI is they'll take your spouse or your surrogates or sperm donor, whichever one you decide to call it. They'll take the sperm, they'll wash it, and then insert the best eggs into the uterus when you are supposed to ovulate. Now this one is usually cheap. They say that the average price is $865, and that's without insurance. Now depending on what area you're in, it can definitely be higher or lower, but the IUI is a quick procedure, literally where the doctor takes that sperm and you're supposed to have already taken the trigger shot and ovulated, and what they're trying to do is trying to get the sperm up the cervix as closest to the egg as possible. Let's see, they say pregnancy rate is 7 to 16% per stimulated IUI cycle. So the percentage is pretty low, but it's something that usually is the first step when you're talking about IVI or infertility treatment. As far as IVF is when there's a couple of types. So I did not know this until I had to actually educate myself. IVF is the basic IVF is when they'll take the sperm, wash it again, but they also retrieve your eggs. They put the sperm and the egg in a dish and still try to have them incubate, but it's not a physical like put the sperm into the egg. put the sperm into the egg piece is the ICSI, which is their intracytoplasm sperm injection. That is when the sperm is actually injected into the egg and they watch it to multiply to turn into the zygote, or the embryo. I forget which one comes first, but yeah. So the basic IVF is just when they put them all into the dish and they try to let the sperm penetrate the egg itself. So the ICSI is something that they actually physically make the egg, put the sperm physically in the egg, and then watch it multiply. So I definitely did not know there was 2 types. That is something I definitely had to speak with my doctor about. But I feel like the sperm injection one would be like a safer one, because then you have how many embryos you actually have in order to insert them into back into the cervix to see if they do attach to the wall and start to grow as a baby. So it is something that you definitely want to speak with your doctor about to see what kind of options you have and what you would be best for your pocketbook. Now, although we have those different types of options that you have for infertility, I definitely would encourage you to speak with your doctor to see which one would be the best for you. But at this point, you're truly making some decisions, so I definitely encourage you to definitely do your research, see where you fit, see about your partner, see what they would feel comfortable with, and then just really continue to work on moving forward. But until next time, keep pushing.